which of the following complications is most likely associated with this patient's condition? So, like again, this is probably a risk factor question, like you said a while ago, because it's an association question. And so we're looking at avascular necrosis, osteoarthritis. This is going to be a what's it called? A bone issue
Yeah.
or
Bone musculoskeletal. Yeah.
yeah. 65-year-old woman, so it's an older woman, presents to PCP with a complaint of persistent bone pain in left tibia. Also reports hearing loss in left ear. So far it's ipsilateral. I don't know if that matters. Lab test shows elevated serum alkaline phosphatase levels. Radiographs reveal cotton wool appearance of affected bone. All right. So buzzwords I'm seeing already is going to be the elevated alk phos and then cotton wool appearance. I don't remember what that is at all. I mean, I know it has to do with the bone. I just don't remember what that is at all. Um, I don't think it's avascular necrosis. Avascular necrosis is, if I remember right, whenever you get like damage of the hip bone and like the femoral vessels, it's not perfusing the bone correctly.
Okay.
Osteoarthritis, osteoporotic fracture, no osteosarcoma. Um, that's a bone cancer. Septic arthritis. Septic arthritis doesn't seem likely because there is they would have mentioned like signs of infection, right? They would have put stuff about like elevated white blood cells or anything like that. Um, Alk Phos usually deals uh, with liver stuff. And so osteoarthritis is more like pain. Osteosart fracture. Cotton wool appearance. I can't remember what that has to do with, but that's like a big buzzword right there. So I'm
Okay.
between osteoporotic or osteosarcoma.
Okay, so let's back up here. I want you to think less of buzzwords, and I want you to think of clinical picture, right? I know that sounds weird, but like you said, this is an older woman coming for her primary care. Okay, so this is in a clinic setting, and she complains of persistent bone pain of her left tibia. So she has chronic bone pain. She also has hearing loss, which is kind of weird. Okay, elevated alk phos level. She has a radiographic cotton wool appearance of the affected bone, which are the following complications. So what I'm going to tell you here on a test taking strategy is if there is something in the question stem or a sentence that you don't know, you have to act like it doesn't exist. Does it make sense? Because you can't use it, right? So if you're like, oh, I don't know what this cotton wool appearance of the affected bone means, well, you can't just keep staring at it and eventually it comes up, right? You got to act like it doesn't exist. So in your mind,
Yeah.
right, in my like what I'm interpreting when you're reading is really what you see is an older patient with chronic bone pain, some hearing loss, and elevated alk phos. Okay, what can be the cause of this?
Okay, so it's an older woman, more prone to like weakness of bones, and then because it's bone pain, consistent bone pain, so it's a chronic thing, and then hearing loss, so it's not a focal issue, it's more like a diffuse or a widespread issue, right? Excuse me. I would go with osteosarcoma because that's more of like a cancer, and that would make more sense in the ear and the leg.
Okay, good. So the way you got there, okay, you use what you knew to get to the answer. Does it make sense?
Yes.
Okay. So I'm gonna clarify it because you're how do I say this? You use 60% of the information to get the answer right, which is what I want you to do. Okay. You don't have to
Okay.
know every single thing to get an answer choice correct. That's what test taking strategy is all about. But her diagnosis is Paget's disease, okay, of the bone. The way I know that
Um,
is because she's older, she has chronic bone pain, and then Paget's disease can happen to any bone in the body. And so you can have hearing loss because your temporal bone can get all messed up too, and that can impinge on the nerve. And you have elevated serum alkaline phosphatase, that's part of Paget's disease. And then also, Paget's disease has that mosaic pattern or the cotton wool appearance on radiograph. So when you put that all together, if you remember, Paget's disease of the bone can eventually lead to, or not eventually, but increased risk for osteosarcoma. Okay. So if you look at everything else, right, let's just say you didn't know that it's Paget's disease of the bone. Avascular necrosis, that's an acute issue. You're not going to have chronic, right? You're going to go to the emergency room, not your PCP. Osteoarthritis, right? That's going to be like knee pain and joint pain, right? That gets worse with use, so that can't be it. Osteoporotic fracture, once again, that's an acute issue, right? You're going to go to the ER, not your PCP. Septic arthritis, you hit it on the nail, right? Is that she doesn't have any infection. So your best answer here is going to be D.
Okay. The way you got that
So
was okay, sure. Got it.
does it make sense? Kind of how you go through
Yeah.
that?
Yeah.
Perfect.
So I feel like I'm taking like the information. I know like it's a thing that we're gonna work on, but I feel like I'm taking a lot of the information and I'm considering why like, oh, everything is so important. It like plays
Sure.
like a big part. And that's why I can't like eliminate answers fast. You know what I mean?
Sure, sure. So the way that I kind of let's use this question as an example, right? You have to first okay, let's kind of back up one step here. What sentence of this stem do you feel as though is the most important? If you were to pick
Um,
the first sentence, the second sentence, the third sentence, the fourth sentence, the last sentence, which one is the most important? And tell me why.
question included? Question included or no?
Question included.
Okay. I think the question is most important.
Okay.
Complication most likely associated.
So people always say this, but I would disagree. The only reason why I tell you to read the questions, the last sentence or the question is because it gives you an idea of what you need to be looking for in the question stem. Okay. But actually, if you're looking at a clinical setting, the most important sentence is the first sentence because that's the patient's chief complaint.
Okay.
Right? When a patient comes into clinic, right, their first words out of their mouth is their chief complaint. Oh, I have hip pain. Oh, I have loss of vision. Oh, I have hearing loss. That is what they're there for. So the first sentence of every question is supposed to be like a chief complaint. So 65-year-old woman with the PCP complaining of persistent bone pain of the left tibia. With just that, right? With just the first sentence, I can eliminate a crap ton of things. So I know that it's chronic pain of her left tibia. So can't be avascular necrosis, can't be arthritis, can't be septic arthritis, can't be a fracture. So most likely already due to age and chronicity, it has to be D, just from the first sentence.
Okay. Got it.
Does it make sense?
Yeah, that makes a lot of sense.
So I
Okay.
want you to put more emphasis on first sentence, but also on top of that, like I said, we're gonna go through more questions and I'm gonna kind of hone in on the test taking strategies. Like I said, don't couple things that we learned today that I talked to you about. Can't pick an answer choice that you can't defend, meaning if you don't know what it is, don't pick it. Number two is that if you don't know what they're saying, right? And you're like, oh, I don't remember that buzzwords. Well, you can't really use it, right? You can't stare at it and say, oh, it's eventually going to come. No, you have to use the rest of it in your context clues.
Got it.